If last week was the first time this health crisis shook the entire nation, this week begins a clear and new phase of intensity across basically every measure we have: the public health impact, the market reaction, the government response. And while this is certainly a harrowing time for so many, it need not be a time for confusion, let alone panic. And here's why. The facts and the science provide a clear path for us right now. There are facts that you can gather that will guide your decisions in the days and weeks ahead. And focusing on the right facts while avoiding misinformation can help prioritize what you do, and literally what you do to make you and your community safer. So that is our spirit tonight as we begin. We have the latest facts and medical guidance for you throughout this broadcast. Here we go. Right now, there are over 4,300 confirmed cases of coronavirus in the United States, which have led to over 80 deaths. We can now report 33 states have closed all public schools, plus additional districts across the country, and slightly more, 35 states declaring formal emergencies. These measures and the wider concerns have the markets tumbling again today. The Dow down a whopping 13%. That makes this, and you may have heard this last week, but now this is true as of today, this is the worst day for the market since 1987. This is a crash that also comes even after the Fed took new stimulus actions like severely cutting interest rates. Now, across the globe, more and more countries are closing their borders to non-citizens. Here in the United States, we're seeing all sorts of new measures. Ohio literally postponing a presidential primary scheduled for tomorrow, the latest state to do so. In cities from Paris to New York to Los Angeles, officials shutting down restaurants and bars and movie theaters. Health experts at the White House press conference today releasing new guidance. Avoid groups of 10 or more, and if you can, just stay home.
No matter who you are, please stay home. If someone in your household is diagnosed with this virus, the entire household should quarantine in the house to prevent spread of the virus to others.
President Trump also struck a somewhat different tone today. He cited experts a bit more. He acknowledged a recession may be coming, and then he credited the role of the press during a national crisis like this. These are notes from the president that are certainly different than usual. We're going to get into that more later in the hour. He also said something big picture, that whatever your thoughts, whatever your politics, whatever views you bring to the way America normally runs, he said something that I bet you can understand or relate to, that we are in a new reality, and it's a reality that could last quite some time.
Is this the new normal until the height of the summer?
We'll see what happens, but they think August, could be July, could be longer than that. But I've asked that question many, many times.
The truth is, no one knows exactly how long this will go. You can name a month, July, August, or later. We do know, though, that experts have told us the nature of the spread of this virus in other countries, which is a very recent type of precedent, suggests that those of us here in the United States are currently still in the early stages of how our nation adjusts and reacts. What comes next, though, depends on several factors. Some we can't control. We know that. But others are behavioral and policy choices that the nation can control. Some of them are at an individual level, limiting interactions, following CDC guidance. Some of them are at the local level, the rules set by local authorities, and some relate to national decisions that the president and the Congress will continue to make. Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.